Hi, I'm Dr. Eric Snow, and today I want to teach you about a product called betaine hydrochloride. This is another great standard process product. I use a lot of betaine in my practice because so many people out there are suffering from indigestion, digestion problems, acid reflux, many different issues. People come in with stomach disorder and digestion disorder. Now, the root cause of a lot of our indigestion in things like reflux. First, it's the foul nutrition. We eat just foods that were not made to be put in our body. They're processed, they're synthetic, they have additives, chemicals, just very hard on the system. And we overeat too. We have to realize our body has to break all this food down, and when we just overconsume food, it's very stressful on the stomach to break this food down. We need enzymes and hydrochloric acid to break all this stuff down. So it gets expensive when we overeat meats and overeat carbohydrates and overeat sugar. It's very expensive for the body to maintain that. And what we see happens is we have the foul nutrition that sets us up for it. A lot of these foods are anti-nutrient, have very low nutritional support in them. And then we have what I call nutritional deficiency disorder. When we start to not get enough of these micronutrients in our diet, our body does not work right. So betaine actually helps to support proper digestion. It is a hydrochloric acid therapy product. So basically what happens when it goes into the stomach, the betaine, which is a B vitamin factor, separates from the hydrochloric acid. And so now we can reacidify the stomach. And it's real interesting the way we've been taught through some of the pharmacological approaches to this is we have the acid reflux, so we think, hey, we need to block acid. But a lot of this acid is really coming from the indigestion when the food leaves the stomach and the small intestine, and it's not digested right because of actual hydrochloric acid insufficiency or hypochlorhydria. It gets into that small intestine, it doesn't get digested right, and then so we get a reflux back into the stomach. And so many acid reflux cases in my experience have actually been corrected, the underlying problem's been corrected by using a hydrochloric acid therapy product like betaine. Now, if your stomach acid issue is really bad, very acute, you can't come in here with hydrochloric acid to begin. The tissues are too inflamed. And so we would look at the diet, remove the offending foods. We might consider some different products like Gastrex, which would go and actually help cool and soothe the stomach. Aloe vera can do that as well. And then once we get things calmed down and we get the offending foods out, then we come in with the betaine so we can get the stomach acid level where it needs to be. And we have to understand, you don't want to go around with weak stomach acid or be on some type of a drug or support that keeps that stomach acid low. You'll get into mineral imbalances because you can't absorb your minerals. You won't break your protein down very well. You get into B12 deficiency. And we have to remember that our immune system is really an immune alliance. And digestion and gut is super key for a healthy immune system. If you don't have good stomach acid, then you can't neutralize very well parasites in your food, bacteria, different pathogenic microbes in there. So we want to have that stomach acid at the normal levels. And so betaine really does help do that. It's great for people that are having trouble digesting protein. Patients will tell me, I really lost that taste for meat. And I hadn't eaten meat in a long time. And that's not necessarily a good thing or a bad thing. It is a complete protein, and you get good grass-fed clean meats, very nutritious. The fatty acid profile is good. Meat can be a really good thing. But what I found out is a lot of these people actually have an underlying condition of stomach acid insufficiency or hypochlorhydria. So they don't have the acid. They put the meat in there and just sits in there because they can't break it down. So a product like betaine taken with your meal will do a really good job at that. It's good to get the minerals up. I've actually seen several cases of anemia where even supporting them with the proper nutrients, maybe it's a B12 issue or a ferrous iron issue, we get in, and if I see they have some underlying causes of stomach problems, then we've come in with a product like betaine, and then we've corrected the anemia because it was really a functional problem of them not being able to break their foods down right. Because it doesn't always make sense. You have somebody who's anemic, but you do a food record and you look at their diet and they're getting good sources of B vitamins and iron and minerals, but they're still anemic. There can be many other factors for that, but one of the ones I've seen is actually a digestion problem. This is also good for patients with osteoarthritis as a nutritional support, because it does have ammonium chloride in it as well, which is a good acidifying factor which can help with the osteoarthritis. And it's great for the aging patient to assist in better digestion. It's great for mineral absorption again, and with the arthritis that a lot of our seniors go through. I have seen, gosh, pretty much anybody that's 60 years old or older, they tend to almost guarantee that they have some type of stomach issue or this low stomach acid. You get them on a product like Betaine and so many things just start improving, because we got to break that food down. We got to absorb it. And if we're not absorbing our nutrients, then our body doesn't have the nutrition it needs to have normal physiologic processes. So this can be a game changer for people that have the digestive issue, and for our seniors not realizing they're really having trouble absorbing and they're in a state of malnutrition. So when I think betaine, I think support proper stomach acid levels, protein digestion, helps to give you a better pH balance in your gut. And so even if you're looking at gut dysbiosis, leaky gut syndrome, food sensitivities, you've got to work on the gut ecology, find the offending foods, get them out of the diet, but we also got to come up top and we got to make sure the stomach is actually working right. We got iron and calcium absorption are really key to have absorption, to have the hydrochloric acid at the right levels. It's going to be good for vomiting or diarrhea. And when it comes to gas, basically how that works is if your gas has a real foul odor, you want to start thinking, I'm getting too much protein, or I'm not breaking my protein down good enough, which you'll have trouble breaking protein down when you have a weak stomach or a low stomach acid. But anybody have trouble breaking protein down, we just eat too much protein in one setting. If you're needing to get your protein up, maybe you're building muscle or you're an athlete, then we just want to make sure we separate it out multiple meals throughout the day so we don't cause stomach disorder. And I found this to be a good support for many different types of anemia. Well, I hope that helped you today. Like our channel, like our videos, subscribe. And if you have a health problem that you think we could help you with, feel free to give our office a call at 337-478-1313. And to get your bottle of betaine, just look in the description box below and we have a link there for you. I'm Dr. Eric Snow, helping you to transform your health naturally.